The mission of the Institute for Community Inclusion was established through its affiliation as a University Center on Disabilities. This initiative was started by President Kennedy nearly 50 years ago, and it's really focused upon building better research, training, service for people with, on behalf of persons with disabilities. President Kennedy was very unhappy about the services that his sister had received. The focus of the University Centers on Disabilities, there's one in every state, and specifically around the ICI, is really to better understand how to support people with disabilities to be part of the community in an inclusive way, regardless of age or capacity or the needs of an individual. So we work both with families and individuals with disabilities. We do research in areas. We try and understand more of what helps the community to engage and support people with disabilities in a meaningful way. I think the collaboration came about because we recognize that the Autism Society of America has an audience of parents and persons who are on the spectrum who we would like to engage and share information and share our knowledge with, and also to gain direct feedback from families and persons who are on the spectrum about what's important, what are the really important research questions, what are the challenges that they're facing around early education, around inclusive education, transition, employment, community living. So we view ASA as a really important partner and an access and a gateway to families so that we can share what we have learned and they can use that in the practice of supporting their sons and daughters, as well as individuals with autism supporting themselves.
I'm a Gopen Fellow. The Gopen Fellowship is an education and training opportunity for self-advocates like me to engage in independent research. My independent research is gathering resources having to do with adults and autism. I'm using ICI's categories of education, employment, healthcare, and community life, and I've added a category of transition. Like many people on the autism spectrum, I've had difficulty finding and keeping jobs that are commensurate with my education. My education is a Master's of Science in Library and Information Science from Simmons University, and I have worked in reference as a librarian, but that was only a temporary job. Another job I had, which was potentially more permanent, was as a library assistant, but that turned out to be a very bad fit, and I wound up leaving on disability. I found a great deal of satisfaction in the volunteer work I've done for different autism organizations, as well as different town committees in the town where I live. And last year I was one of two self-advocates who was a LEND Fellow. LEND stands for Leadership, Education, and Neurodevelopmental Disabilities at Boston Children's Hospital, in which I enjoyed taking classes and engaging in group projects with students from different disciplines, and also advocating on Capitol Hill in Washington, D.C. And this year as a Gopen Fellow, I like having being able to work on my own schedule, work from home, make my own hours. And but even though I'm independent and by myself, I know that even when I'm by myself, I'm never alone. I belong to a community of dedicated advocates who are like-minded.
And just adding to Gyasi's comments too, is that the role of the Gopen Fellowship, as he's very nicely laid out, is really a leadership role, and we expect that the graduates of the fellowship will become leaders in the field of disabilities. In the fellowship that Esther is doing, it's really a way for us to begin to look at what are the materials and the information and supports that we can offer to ASA and the members who visit the ASA websites in around issues of transition and post-secondary employment opportunities for individuals on the spectrum, also around community living, around issues of self-determination, and finally looking at some of the policy and practice areas. So Esther's role really is to identify some of the materials and efforts that we've had over the last 50 years. Esther herself is a doctoral student who's in the School for Global Inclusion and Social Development, and she will be going back to her country and leading the initiatives around developing NGO systems that will be fully inclusive. So we're all learning, but the tune is all about leadership and inclusion. Wow. It's interesting, in the literature and in the news media, you hear a lot about the unemployment rates. And we talk about the unemployment rate being 2 or 3% or 4%. And what that really means is that most of the people who are working, and there's a very small number who aren't, for people with disabilities, it's the inverse. And so what we have is maybe 40 or 50% or even more of the population of persons with disabilities aren't employed or aren't in the workforce. My goal is to have the labor force participation rate for persons with disabilities and without disabilities be the same. So that's our goal, is to really make sure that the talents, skills, and abilities and the aspirations of people with disabilities are reflected in a way of being a member of a strong labor force and having the resources that they can live in an independent way.
I guess one thing I would hope to see is an expansion of some of the positive trends that exist. I look at some of the tech companies like Microsoft and Dell that have initiatives to hire people on the spectrum and professional positions, and I guess I would like to see that expanded to include other skills like researching, writing, public speaking, and other industries like advertising, publishing, journalism, and I guess I'd like to see it expanded. And, but also I think about the direct service staff and how we have a dearth of direct service staff. And I'm thinking people on the autism spectrum can probably fill those jobs too. And also I'm thinking also autism organizations themselves. You know, they can set a good example by hiring people on the autism spectrum and maybe even give a model of best practices.
I guess it would be higher, higher, higher. How's that? But I think the reality of it all is all of us come with some preconceptions of people, and whether it's somebody who's on the spectrum, or somebody who has a disability, or somebody who's a different color or a different religion, employers have to drop the stereotypes that they have and begin to look at the person first and begin to understand what a person can really bring to their company. Second one is expectation. I think it's really important that employers expect that persons with disabilities will contribute, and they can contribute, but they ought to be held to the same standard that everybody else is held to. And the third one is it's not just the first job we're interested in careers and opportunities to advance.
I guess my 3 points would actually come from what you do before you interview. I mean, first I would start by doing research on the company you're interviewing with. Even if you've already done the research, review the research so it's fresh in your mind. I would also look over what you submitted, not only to get that fresh in your mind, but I would also think of places where you may want to add or maybe expand on a few points. And related to that, the third issue is I would actually go do a mock interview in your mind and think about why you want to work for this company, what your skills are, what your experiences are, and how would you express that? What examples would you give? You know, this will help you, you know, when you're, so you won't draw a blank when you're faced with that frightful request, tell me about yourself, but also you'll have material that you can draw from in the back and forth of the conversation.
I think my inspiration came at a very early stage when I had a father who had polio, and he always walked funny. He did everything that everybody else could do, but he had a disability. And I saw that he could do lots of things in the community, and I saw also sometimes the community didn't expect as much from him. So I think I started early, and we lived in a house where disability was part of the human experience. It was just what it was. And that way, growing up, my father sort of set the tone for saying, expect and support and believe in the community.
One of the things that's inspired me is one of the things I've learned especially like in the last couple of years as a LEND Fellow and even now as a Gopen Fellow, is the amount of groundwork that's already been laid. That in essence, when I was first diagnosed with autism back when I was 17, and when I was in college, I started to question the diagnostic criteria. And I've learned that actually long before I ever did that, people were already successfully challenging the status quo and making very important changes. So all the groundwork that's been laid before me actually inspires me, and inspires me to sort of take up the mantle and to continue to move forward.
I think Gyasi made a very compelling argument to say that the employment and the participation in the workforce is everybody's responsibility, the NGOs, the private side, the public side. And that has always driven us, too, that the ICI has about 30% of its staff either have a disability, and if we add in the folks who have family members with disabilities, we're probably at 50%. That's not part of the criteria, but it certainly is part of the area of interest in recruitment for us.